Hello everyone. Let's talk about the musculoskeletal pharmacology. What all the medication that we used in musculoskeletal system? There are a few groups that we can remember. Muscle relaxant is one of them. Muscle relaxant is used when patient has muscle spasm. Few medications are very important for exam point of view. They are cyclobenzaprine, tizanidine, carisoprodol, and baclofen. These are the medication which are important. Cyclobenzaprine, tizanidine, carisoprodol, and baclofen. This medication, they do relieve muscle spasm and improve mobility. Another group that we use in musculoskeletal system is osteoporosis medication. Osteoporosis is softening of bone. When bones are soft and fragile, there is a higher risk of having pathological fracture. And so to prevent that, we do use biphosphonate and SERMs. SERM is selective estrogen receptor blockers, and the medications are raloxifene and tamoxifen. Tamoxifen is used for breast cancer because this medication is effective for hormone related tumor. Okay, so biphosphonate examples are alendronate. The medication ends with dronate or biphosphonate. Alendronate, risedronate, and SERMs are raloxifene, tamoxifen. So these medications increase bone density and thereby reduce fracture risk. Another group is DMARDs, disease-modifying anti-rheumatoid drugs. Disease-modifying anti-rheumatoid drugs. And there are two groups here, non-biologics and biologics. You can just remember the name of the medication, methotrexate, hydroxychloroquine, etanercept, adalimumab, infliximab. So the medication ending with mab, Cept, and this medication, methotrexate and hydroxychloroquine. These two medication can also be used for autoimmune disease, okay? Other autoimmune disease. And hydroxychloroquine and methotrexate, these two are very important medication for rheumatoid arthritis. Okay, this medication can also be used in cancer. All right. So this medication slow the progression of autoimmune joint disease, that is rheumatoid arthritis. Another group that we need to remember is anti-gout medication. These three medication that we can remember for the exam: allopurinol, colchicine, and probenecid. Allopurinol, colchicine, and probenecid. This medication, they do reduce uric acid level and prevent gout attack. So we'll talk about this in more detail, but these are the groups that we have to study in musculoskeletal system. So let's talk about the muscle relaxant. Muscle relaxant, this medication is going to relax the muscles, thereby decreasing muscle spasms, specifically skeletal muscles, caused by injuries like fracture or sometimes inflammation or anxiety related tension. When sometimes patient is anxious, what happens is muscle tension occur, muscle gets stiff, spasm. That time we can use a muscle relaxant. So example we already discussed: cyclobenzaprine, tizanidine, carisoprodol, and baclofen. Need to remember one thing here for the mechanism of action. This medication works on CNS, central nervous system. It suppresses the CNS activity, decrease the CNS activity, thereby it relaxes the skeletal muscles. So most of the side effects are related to CNS system. So you can see here sedation and dizziness are the most important side effect from this medication. So please do remember one more time, this medication decreases CNS activity and thereby relax the skeletal muscles. So majority of the side effects are related to CNS system. So one side effect is sedation and dizziness, most important. And so there is very important point here: as patient gets sedated and dizziness as a side effect, we need to advise the patient to avoid combining with any other CNS depression, for example, opioid, alcohol, or any other muscle relaxant. Why? Because if patient is taking opioid is also down, right? CNS activity goes down, and this medication also decreases CNS activity, so there is an increased effect, okay, and patient will be more dizzy and drowsy. So there would be double effect from combining this medication. So it's very important that you advise to your patient that to avoid any other CNS depression along with this muscle relaxant. Okay, advise caution with activities that require alertness, for example driving, swimming, machine operating. All these things patient should avoid. Why? Because while taking this medication, patient can be dizzy and drowsy. We don't want this patient to perform any activities that require alertness, because accidents may occur, right? So there is a safety related important intervention that you must have to remember for the exam. Implement fall precaution, and that is the reason, as per the beard criteria, we do not advise older people to take this medication. Why? Because older people already have higher risk of falling down, and when they are on this medication, there is increased risk of fall. And hence Nclex always focus on safety. So it is very important that you advise your patient about the fall risk. And also hepatotoxicity, so liver can get damaged. So when patient who is taking this medication for long period of time, and if patient complains about yellowish discoloration of skin, sclera, abdominal pain, fatigue, all those symptoms, you have to check LFT, liver function test, because possibly liver damage is occurring from this medication. Okay, so what are the side effects? One more time: sedation and dizziness, you can remember. Second most important point related to that, that you have to advise the patient to avoid any other CNS depressions like opioid, alcohol, or other muscle relaxant. Also patient needs to avoid any activities that require mental alertness. Fall precaution, you have to advise to the older people. And fourth one is hepatotoxicity can occur. Okay, so what are the name of this muscle relaxant? Cyclobenzaprine, tizanidine, carisoprodol, and baclofen. All right, next is about the osteoporosis. Very important group, biphosphonate. So whenever patient is on biphosphonate, we have to advise the patient to take this medication with full glass of water. Why patient needs to take with full glass of water? Because we don't want this medication to remain in the esophagus. We want this medication to pass easily to the stomach. Why? Because this medication is highly irritant to esophagus. Okay, so we advise the patient to take this medication with full glass of water, so medication can go into stomach. Second important thing that you are going to advise the patient to remain upright for 30 minutes after taking this medication. That means after taking this medication, patient is not allowed to lie down. Very important. Why? Because if patient lies down soon after taking this medication, there is possibility that medication can come up and can irritate esophagus. So we advise the patient to take medication with full glass of water. Second thing, 30-minute patient needs to be upright after taking this medication. Okay. And biphosphonate, any medication ends with dronate. Dronate, that is biphosphonate. And you have to advise these two pieces of advice that you have to give to the patient. Okay. How it works, it slows down bone resorption by decreasing osteoclast activity. I can also give in simple I can give you simple example here. When bone demineralization occur, bone breakdown occur, what happens is the calcium get released from the bone and enter in the blood vessels. This medication, biphosphonate, is going to prevent this bone demineralization. So when bone demineralization slows down, automatically release of calcium slows down, and so bone density or strength improves. Okay, another one is SERM, that is selective estrogen receptor modulator. Medication ends with Zifen, okay, tamoxifen or reloxifene. Treat osteoporosis by decreasing bone resorption and treat the breast cancer by slowing down tumor growth. Okay, now this medication can cause hot flashes, leg cramps, and blood clot. Now, if you can recall menopause from maternity. So menopausal signs and symptoms: hot flashes, okay, hot flashes, mood swing, patient will remain irritated, insomnia. So these are the symptoms of the menopause. Now, why patient has menopause? It's a natural process. But my question was to ask you, like, what happens in the menopause? So what happens is decrease estrogen. Okay, there is decreased estrogen, and because of that, patient is experiencing this side effect. So here, if you understand the mechanism of this medication, what it does, it blocks the estrogen receptors. It blocks the estrogen receptors and thereby decrease the estrogen. When estrogen is decreased, patient is going to experience the same side effect. Okay, so you can remember here, like symptoms like menopause, symptoms as a side effect like menopause, like hot flashes, leg cramps, mood swings, those symptoms can occur. Another important thing that you need to remember is blood clot and also abnormal vaginal bleeding. If patient comes with complaint of abnormal vaginal bleeding, you need to give priority to that patient. Okay. Second thing, when patient has unilateral leg swelling, redness, warmth, or pain in calf muscles, you have to prioritize that patient because possibly patient might be experiencing DVT. So with this medication, there is a risk of blood clot, as well as if patient comes with complaint of abnormal vaginal bleeding, you have to give priority to that patient, or maybe you have to take some intervention to find out what is going on, because there is a strong association of endometrial cancer with tamoxifen. Okay, endometrial cancer with tamoxifen. All right. And safety monitoring and risk reduction. So decrease risk by avoiding prolonged immobility and not smoking. Very important. And report signs of DVT, swelling, redness, and warmth. I just explained to you, it is about the same medication. Okay. All right. Next is about the gout medication. 3 medication that we do remember: allopurinol, probenecid, and colchicine. Please do remember one point here. Allopurinol is for maintenance. Okay, maintenance. It cannot treat the acute gout attack. Colchicine is for acute treatment. It is anti-inflammatory medication. It is for acute gout attack. It is not for prevention. So gout is something that uric acid level increases, right? So allopurinol will decrease the uric acid and will maintain the level, low level or the normal level, we can say. Whereas this one works as anti-inflammatory. So when patient has acute gout attack, that time we can use this medication, but this medication cannot be used for the maintenance. Whereas this medication can be used for prevention of gout attack in the future. So how it works, it decreases uric acid level, prevent and treat acute gout flare. It also decreases joint inflammation. All right. So allopurinol decreases uric acid production. Probenecid increase the uric acid excretion. So allopurinol works on production itself. Okay. It decreases the production. Whereas probenecid, what it does, it excrete the uric acid via urine. And colchicine, it is anti-inflammatory, so it decreases the inflammation. Okay, whenever you are giving this medication, as this medication is excreting uric acid via kidney, you need to help kidneys to remove all this extra uric acid. And for you, the priority is to increase the fluid. 2 to 3 liter per day you have to increase, because you have to decrease the load on kidney. Okay, kidney has to excrete all this uric acid out, but we want to help kidneys to decrease the workload. We need to keep kidneys hydrated. So advise your patient to drink at least 2 to 3 liters per day. All right. And then second thing, there is also a risk of kidney stone. If the patient is dehydrated, what will happen? The uric acid will get deposited in the kidneys, making kidney stones. So that is also another reason to prevent the kidney stone. We are increasing the fluid. Diet related modifications you have to advise to the patient when patient has gout as a diagnosis. Avoid alcohol and high purine diet. Avoid alcohol and high purine diet. This is very important point for your exam point of view. Okay, in exam they do sometimes ask the diet management, or in general the patient education with diagnosis of gout. So you need to advise to your patient to avoid alcohol as well as high purine diet, that is red meat, organ meat, that can increase uric acid level. So 3 medications that we need to remember: allopurinol, probenecid, and colchicine. Allopurinol decrease production, probenecid increase excretion, and colchicine works on inflammation. Okay. And talking about the side effect of colchicine, I also wanted to add something here. GI side effect can occur. GI patient can have diarrhea, nausea, vomiting. GI side effect can occur with colchicine. Okay. And allopurinol can cause agranulocytosis on long time use. All right. Next is about the medication for rheumatoid arthritis, disease modifying anti-rheumatoid drugs. So we do have two medication here, methotrexate and hydroxychloroquine. I'll share one story. We had one patient who had, something going on in her foot, and she was not getting better. We tried all different kind of anti-inflammatory medication. Initially, we thought that it's osteoarthritis, and so patient is having pain. We took X-ray and everything, but we could not rule out. Okay, and so finally, we decided to send that patient because patient had only problem with one foot, and again toes. Okay, greater toe, second toe, those two toes only had a problem, only in one leg. So after trying all different kind of medication, we finally decided to send this patient to, rheumatologist, just to make sure that patient is not having any rheumatoid arthritis. So patient went there, the rheumatologist ordered all different kind of, blood test, all different type of, the C-reactive protein and rheumatoid factors and everything that they ordered. And patient was diagnosed with rheumatoid arthritis. So the rheumatologist, they wanted to start the patient on hydroxychloroquine. Okay, but for that, um, eye checkup is required before starting that medication. Eye checkup is required. So patient came back to us asking for the ophthalmologist referral, and I was asking, like, what is the reason to go and see ophthalmologist? And patient said that rheumatologist wants to start hydroxychloroquine. Before they start, I have to see eye doctor and get the recommendation or the report or the results of the eye checkup. Then only they will start the medication. And why is that? Because this hydroxychloroquine causes retinal damage. So please do remember, hydroxychloroquine damage the eye. So when patient who is on that medication, annual eye exam should be done. Okay, and immediately you have to report any vision changes like blurry vision, floaters, anything. If patient develops, you need to refer this patient to ophthalmologist and immediately report to rheumatologist. All right. Okay, then methotrexate. So methotrexate we had also used in ectopic pregnancy, if you can recall. Sorry, ectopic pregnancy. Ectopic pregnancy, we use this medication to prevent the cell division and to prevent the rupture of the ectopic pregnancy, the fallopian tube. Okay, so that time we do use this methotrexate. So methotrexate has few side effect. Immunosuppression, it works on bone marrow, suppress the bone marrow and causes immunosuppression. Why? Because patient has decreased WBC, decreased RBC, decreased platelet count. So with that, anytime if patient who is on this medication, if they develop any signs of infection like fever, sore throat, fatigue, you need to report to doctor. Another side effect is liver damage, hepatotoxicity. And so it already damaged the liver. We need to advise the patient to avoid alcohol, and we have to keep monitoring liver by liver function test. And you have to report any signs of liver injury like dark color urine, yellow color eyes, yellowish, sclera skin. All those symptoms you need to report. And risk for birth defect. And so when patient who is on this medication, they have to use reliable contraception. Okay, so methotrexate causes immunosuppression, hepatotoxicity, risk for birth defect, and the hydroxychloroquine causes retinal damage. Another one, we do have etanercept, adalimumab, infliximab. So this medication also causes immunosuppression. And these medications we have used in multiple conditions like multiple sclerosis. So that time also we had talked about, okay, when you use this kind of medication, you need to check the patient for infection because this medication causes immunosuppression. So anytime a patient develops fever, sore throat, fatigue, you need to report to healthcare provider. Avoid live vaccine because their immunity is decreased. You have to avoid live vaccine like MMR vaccine, varicella. These are the live vaccines. You have to avoid live vaccine. Must test negative for tuberculosis before starting, because what happens is when patient's immunity will go down, patient will have activation of latent tuberculosis. Now, what is latent tuberculosis? So patient do have the bacteria present, but they are in dormant state. That means they are sitting, they are sleeping at this point. Why? Because they are not capable of attacking host, because host immunity is very powerful, and so these bacteria are just sleeping. Okay, they are in dormant state. Even if they want to attack on host, they don't have capacity to do that. So patient is not showing any signs and symptoms of tuberculosis, but he is positive for TB. He is not contagious, he doesn't show any symptom, but he is positive. So that is called latent tuberculosis. What happens is, anytime if patient's immunity goes down, these sleeping microorganisms will get awake because they got chance that, oh, host immunity is down and this is the right time to attack on the host. Okay, so those microorganisms will get activated and we don't want that. So what we do before starting this medication, we check the patient for tuberculosis, latent tuberculosis specifically. Okay, because immunosuppression may active latent tuberculosis. All right, so this is about anti-gout medication. All right, just to conclude, we talked about muscle relaxant, cyclobenzaprine, tizanidine, carisoprodol, and baclofen. And the main side effect is sedation and dizziness. Why? Because it works on CNS activity. It decreases CNS activity, thereby relax the muscles. So sedation, dizziness are the side effect. You have to advise the patient about the safety, about the fall precaution, also about not operating any machines that requires alertness, and patient should not take this medication with any other CNS depression. Okay, and we talked about osteoporosis. So osteoporosis, biphosphonate we discussed, and SERM we talked about. So biphosphonate, patient need to remain upright for 30 minutes after taking that medication, and patient needs to take that medication with full glass of water. Why? Because it is esophageal irritant and we don't want this medication to remain in the esophagus and cause irritation. Okay, so that is the one. And tamoxifen, raloxifene, this medication are estrogen receptor blockers. They decrease estrogen, so the side effect will be like menopause, hot flashes, and mood swings and insomnia. Those are the side effects. But the two important side effects that you need to remember, that is a blood clot. For blood clot, you have to monitor the patient for unilateral swelling, redness, warmth, cough, pain, or if patient is complaining about short of breath, chest pain, so pulmonary emboli we need to monitor the patient for. And the another one, if patient is coming with abnormal vaginal bleeding, then you have to take intervention. Why? Because there is a strong connection between tamoxifen and endometrial cancer. Antigout, we talked about allopurinol, probenecid, and colchicine. Allopurinol decrease the production of uric acid. Probenecid increase the excretion of the uric acid, and colchicine works as an anti-inflammatory. So colchicine can be used in treatment of acute gout, whereas allopurinol and probenecid can be used for the maintenance therapy. Now, these medications are going to excrete the uric acid, right? So kidney has to handle this all extra uric acid, and you as a nurse need to advise the patient to keep himself hydrated, well hydrated. If not, then what happens? Dehydration can lead to kidney stone, and we don't want that. Okay, and another one that we talked about is anti-rheumatic drugs. Anti-rheumatoid drugs has methotrexate, hydroxychloroquine. Hydroxychloroquine, you have to remember that story. We have to check the eye before starting hydroxychloroquine for rheumatoid arthritis because it causes retinal damage. Anytime when patient is on this treatment on hydroxychloroquine, anytime if patient develops any blood vision, halos around the eye, halos around halos while seeing something, or any vision related problems, need to notify to healthcare provider. And methotrexate decreases, it causes immunosuppression, causes liver damage, so you need to check for the yellowish discoloration of skin, sclera, those kind of symptoms. and we need to advise the patient to use proper contraception because that is teratogenic medication. And other medication that we talked about, adalimumab, infliximab, or etanercept, this medication causes immunosuppression as well. So we need to check the tuberculosis before starting this medication for the latent tuberculosis. And you have to be very careful because this medication causes immunosuppression. So you have to follow strict aseptic techniques, and you have to advise the patient to report fever, sore throat, or any infection-related signs and symptoms. Okay, and live vaccines should be avoided. Live vaccines should be avoided. All right, so that's the end of the musculoskeletal system pharmacology.